Hello, this is pharmacist Wendy Lee of Hawthorne Pharmacy giving you 3 more health screening tips for our women. So far, I've discussed blood pressure, diabetes, cholesterol, dental, eye, and infectious disease screenings. Today, we're going to talk about cervical cancer screenings. Cervical cancer screenings typically begin at age 21. Women with a cervix, ages 21 through 29, should have a pap smear every 3 years. And women with a cervix, ages 30 through 65, should have a pap smear every 3 years or an HPV test every 5 years. Women who have been treated for precancer should continue to have a pap smear for 20 years after treatment or until age 65, whichever is longer. If you've had a total hysterectomy, which is when you had your uterus and cervix removed, and you have not been diagnosed with cervical cancer, you may not need to have pap smears. After age 65, you can stop having pap smears if you have not been diagnosed with cervical cancer or precancer, and you've had 3 negative tests within the past 10 years. Skin cancer is another screening that is very important for women. Physical exams for screening for skin cancer should be performed, especially if you're at high risk. High risk factors include having skin cancer before or have a strong family history of skin cancer, or if you have a weakened immune system. This is very important to get screened for skin cancer. Colon cancer, if you are under the age of 45, you should talk to your provider about getting screened, especially if you have a family history or you have a family history of colorectal cancer or have a history of polyps. At age 45, screening typically begins for colorectal cancer, and this can be done as a blood or stool test or as a procedure like a colonoscopy. Until age 75, screening should be done on a regular basis, depending on what type of test is being performed. This concludes 3 more health screenings for our women. Stay tuned for tomorrow's last segment and the last 3 screenings. Thanks again, and stay healthy.